Alright, in today's video we are going to talk about dexmedetomidine. We're going to see what the drug is, what it does, and what is the effect of what it does, and how we use it in daily life. So, dexmedetomidine is a highly selective alpha-2 adrenergic receptor agonist. Now, when I say alpha-2 receptor, I am referring to that specific G protein coupled receptor located in the central nervous system, in the brain and the spinal cord, then also in the peripheral sympathetic neurons specifically. Then when I say it's an agonist, I mean that the drug activates the receptor to produce a physiological effect. In other words, the drug is having an intrinsic activity but is activating the receptor. So I just wonder how the drug is activating a receptor, yet the receptor, I'm going to tell you that is G inhibitory. So you see, we shall activate an inhibitory receptor. So what will happen is inhibition of everything that the receptor will be aligned with. So in simple terms, Dexmed is activated Dexmed activates the inhibitory alpha-2 receptors, and this will reduce the sympathetic nervous system activity. We are going to tell you exactly what is going on. So, first of all, before we understand how the drug works and whatever, we are going to first look at the reciprocation of the alpha-2 receptors, as I told you in summary, but I'm going to be specific where the receptors are, so we can understand when the drug binds to the receptors, and we tell you what happens to the receptor, and we tell you what is happening to some pathway. Of course, we shall tell you sedation and pain control. So we are going to say that the alpha-2 receptors, they are strategically located, number one, in the brain stem, specifically in the nucleus called the locus coeruleus. This is the primary site for sedation. Now, the locus coeruleus has a role of regulating arousal and wakefulness through norepinephrine release. That's why, guys, when you think about norepinephrine, think about sympathetic activity. That's why when you are in fear, you can't sleep. When you are in pain, you can't sleep. You get it? So that's location number one. Location number two is the spinal cord. The spinal cord, as you know it has very many parts. So is the specific part of the spinal cord where the alpha-2 receptors are located is the dorsal horn. In the dorsal horn, you know that is mostly the place for ascending tracts and whatever. So on those tracts, we can include the pain pathway, and so that's why we say that alpha receptor receptors in the dorsal horn of the spinal cord modulate the nociceptive transmission. Then activation will reduce pain signaling. So that means there will be a target for the dexmedetomidine that will activate these receptors in the dorsal horn to cut off the pain sensation. So that's location number two. Then location number three is the presynaptic sympathetic neurons. This is very, very important. Now, I know you guys have been trying to ask yourself what is this receptor is doing on the presynaptic membrane. But very shortly, I'm going to tell you that in this location, when it is located here, it's going to regulate systemic norepinephrine release. And this one, since it is systemic and is everywhere, it is also going to affect the heart rate and the blood pressure. Now, in the central action in the brainstem, it is responsible for sedation, while in spinal cord and peripheral actions account for analgesia and hemodynamic effects. Now, we are going to the molecular mechanism, how it works. Now, when dexmedetomidine binds alpha-2 receptors, two things great happen. Number one, the receptor activates a GI or the G protein, which is inhibitory. Then the G inhibitory protein will reduce the adenyl cyclase. This will result in reduced CAMP. Now, when we have reduced CAMP, it means we shall have reduced calcium influx. What is this one meaning? This means that we know well that CAMP normally facilitates calcium influx into the presynaptic cell, and this one facilitates neurotransmitter release. Now, when we have reduced CAMP due to reduced adrenal cyclase, which was due to reduced activity caused by dexmedetomidine, it means we have reduced norepinephrine release. Now, this decreased excitatory signaling in the central nervous system and the periphery is what is going to be the importance of dexmedetomidine. Now, sedation is one of the effects of dexmedetomidine, as you can see. But wait, why does sedation happen? Now, understand this, that reduced norepinephrine in the locus coeruleus will lower the brain's arousal tone. Now, the patient will become calm, will become sedated, yet there is arousal. Now, this is different from general anesthesia or opioid-induced sedation. So, mechanistically, this sedation closely mimics physiological sleep, preserving respiratory drive. So this person would have respiratory drive, would be like he's having a normal sleep. You can tap on them and they just wake up. When you leave them, they go back immediately. So that's it. Then how it produces analgesia, or how pain is reduced. We said analgesia, you are either reducing the pain or you are completely eliminating the pain. Now, in the spinal cord, in the dorsal horn, the nociceptive neurons release substance P, which is a neurotransmitter, and also release glutamate, which is an excitatory neurotransmitter. These two are important for propagating pain. Now, alpha 2 receptor activation, remember it is inhibitory, so it's going to inhibit the presynaptic release of these neurotransmitters. Now, the result is reduced transmission of pain signals to the brain, which provides analgesia without what? Opioids. Remember, the major analgesics, we say that they're strong opioids, but now we have already used dexmedetomidine, which is not an opioid, to provide analgesia. This is very good because in one of the ways you'll see in what we call multimodal analgesia, you'll find out that we use many drugs to provide analgesia, and we shall reduce the amount of the opioids or other non-opioid drugs like NSAIDs that we may need to use. Now, then you can also that can also cause hemodynamic effects. For example, reducing heart rate and reducing blood pressure. Now you'll be asking yourself, how does this one happen? Let me tell you how. Now, sympathetic tone decreases due to what? Norepinephrine. Okay. Then the heart rate will decrease because of beta 1 receptor stimulation is also reduced. Blood pressure will decrease because peripheral vasoconstriction is reduced. Now, what's something to note here is that at a high dose, the peripheral alpha 2 B receptor, because this is another subdivision of alpha 2 receptors, will become activated and may cause transient vasoconstriction and producing a brief increase in blood pressure. Then, after the central effect will take control, which means there will be biphasic effect. First, there will be increase in blood pressure. Then, after when the distribution and the dose starts going down, the drug will cause hypotension. So this drug is very, very important, and it is unique. Number one, let me show you what is unique about respiratory safety. Now, dexmedetomidine does not act on the medullary respiratory centers, so the patients will maintain normal tidal volume and respiratory rate even at sedation doses. So this makes it safer for procedural sedation in ICU or sedation compared to opioids or propofol. So what are the clinical applications of this? We use this one in ICU sedation to make sure the patient is calm, arousable, and again also used for procedural sedation elsewhere. You can have minor surgeries like a weak craniectomy and have imaging. So it is also used as an adjunct to anesthesia. It reduces requirements for other sedatives and opioids, as I told you in multimodal analgesia. Then it has an effect of sympatholytic lysis, and this will grant the reflexes. And during intubation and surgery, we have a reduced stress or sympathetic stimulation. Now, in this case, when we use this drug, we need monitoring. We need to monitor the heart rate, blood pressure, and we need to monitor the sedation level. We can use the RAS score, see how we are performing. So it has side effects as I told you, bradycardia, hypotension, and sometimes can cause nausea. Transient hypertension is if it is in high doses. Okay, then I can recap for you now, and I tell you that now. Look at this diagram and try to understand what's going on. Dexmedetomidine is an alpha 2 receptor activator, and to activate the GI protein, which is an alpha, which is associated with alpha 2 receptor, we reduce adenyl cyclase, reduce CMP, reduce norepinephrine release, and we reduce sympathetic tone. The result is sedation, analgesia, reduced heart rate, and blood pressure. Thank you for listening. We see you tomorrow when we meet again for another topic of this day. Like and share this video. Subscribe to our channel so that you don't miss out on any other topic that we shall be discussing. We are discussing one topic per day. Get started here.